Hello guys, so let's solve MCQs from Organon of Medicine. So the question is like Hahnemann born in the year 10th April 1755. Hahnemann took his MD degree from in Largen University. Hahnemann took dram of good china twice a day, 4 dram. An essay on new principle for ascertaining the curative power of drug was published in Hoofland Journal. Yes. Then who published first periodical of homeopathies? Hahnemann, Bonninghausen, Staff. So fifth C. Okay. Life and Letter of Hahnemann was written by T.L. Balford. Okay, T.L. Balford. Life, 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 and letters of Hahnemann's was written by T.L. Balfour. Hahnemann translated Cullen's Materia Medica in the year 1790. Hahnemann translated Cullen's Materia Medica in year 1790. ये ईयर याद करने में बहुत प्रॉब्लम होती है एक्चुअली. So the poll is, today's question is uh, हेलो. मैं लाइव हूँ. So the today's question is like Novum Organum was written by whom? If you know the answer, please write it down. Uh, the law of similia similibus curantur was known to Hippocrates, Ditharding, Baldock. Hippocrates, Ditharding, and Baldock. 9D. Doctrine of homeopathy were formulated first time by Hahnemann in Medicine of Experience, Organ of Medicine. Doctrine of homeopathy were formulated first time by Hahnemann in Medicine of Experience, 10th Medicine of Experience. There are 7 cardinal principle. There are how many cardinal principle of homeopathy? There are 7 cardinal principle of homeopathy. Who first applied similibus curantur as the only method of treatment? Hahnemann. There are lots of name: Hippocrates, Aristotle, Hahnemann, and none. In who applied first? It is applied by Hahnemann. Who who told quality of action of homeopathy? Homeopathic remedy is determined by its quantity in inverse ratio. Who told quality of the action of homeopathic remedy is determined by its quantity in inverse ratio? Options are like Maupertus, Hahnemann, and one more is there, Finke. The right answer is Finke. Hahnemann experimented year to discover chronic disease. Hahnemann experimented around 12 years, 12 years. Hahnemann experimented around 12 years to discover chronic disease. The word organon derived from the word organum, Greek. The word organon derived from the word organum in a Greek. That organon was derived from the word Greek. Organum means literary work, scientific investigation, instrument of thought. That is, we know everyone. The word organon was first used by Aristotle. Not the word organon was first used by, not by Hippocrates, not by Hahnemann, not by Lord Francis Bacon. The word organon first used by Aristotle. Uh, Novum Organum was written by, that question is asked in the Q&A. Organon of Medicine was written by Hahnemann. First 1910, 1810. First edition of Organon of Medicine was published in 1810. The title Organon of Medicine was given in edition 6th. Edition 6th. Okay, 21st D 6th. Theory of chronic disease was introduced in edition of 5th. 4th, sorry, 4th. 12. C. Okay. Which one is the first time included in the fifth organ of edition of organ? Which one is the first time included in the fifth edition of organ? Doctrine of vital force, doctrine of dynamization, or 50 millisievert potency. 50 millisievert potency it is introduced in sixth edition. Doctrine of vital force and doctrine of drug dynamization. The both are discovered in the put in the included in the fifth edition. The title organ of healing art. The title organ of healing art is in edition of organ second to fifth. Okay. The title organ of healing art is in edition of organ second to fifth. Gillet's poem first appeared in right, writing of Hahnemann, organ first, that everyone knows. Gillet's poem was appeared in the first organ. Edition of first ever translation of organ is second edition. Second edition is the first ever translation of organ. Second edition, what is that question? Okay. First edition of organ was translated by C.E. Wheeler. First edition of organ was translated by C.E. Wheeler. Namit Tundre, hi. Hi Namit. First edition of organ was translated by C.E. Wheeler. Gillet's poem was replaced by Odyssey from edition from second edition onwards. Second edition of organ was translated by Ernest von Bernow. Okay. Fifth edition of organ was translated in English by R.E. Judgeon in 1893. W is all. Okay. 30th D. Okay. Disappear means dare to be wise, dare to know, having the courage of your own conviction. Dare to be wise, dare to know, have the courage of your own conviction. Anti-homeopathic archive was written by Dr. Simon. 34. 34A. Anti-homeopathic archive was written by Dr. Simon. Okay. Disease should be annihilated in all way. Shortest, most harmless, most reliable. Okay. Second. Okay. True practitioner of healing arts should have knowledge of disease, knowledge of medicinal power, knowledge of dose. Preserver of health in aphorism 4. Preserver of health is in aphorism 4. Preserver of, okay, yep. Accessory circumstances includes social and domestic relations, age, sexual function, moral and intellectual character. Causa occasionalis means exciting cause, maintaining cause, and fundamental cause. Okay. Khushi Suvarna, hi. Khushi Suvarna, hello Khushi. So causa occasionalis means exciting cause, maintaining cause, and fundamental cause. Exciting cause, maintaining cause, and fundamental cause. Okay. The word accessory circumstances is written in the aphorism 7. Accessory circumstances. The word accessory circumstances. How are you, brother? Namit, I'm fine. How are you? How's your studies going on? You must be in fourth year, I think. Namit, accessory circumstances, yeah. So the word accessory circumstances is written in the aphorism 7. In healthy condition, the vital force has property autocracy. Healthy condition, vital force has property of autocracy. Namit, I am fine. How are you, Namit? Curable disease manifests itself by illness, curable disease, sign and symptoms, dynamic influence, derangement of vital force, sign and symptoms. Curable disease manifests itself by sign and symptoms. All good, doctor. Yeah. How's your fourth year is going on? Which one is spirit like? Vital force, experimental inimical force that disturb harmonious play of life, alternative power of serviceable medicine. All. That is sole indication, sole guide to choice remedy. Totality of symptom, portrait of disease, miasmatic diagnosis. Totality of symptom, totality of symptom, sole guide to choice remedy. Yeah, Namit, I'm fine. Fourth year, how is going on? Spirit like power of medicine can be discovered by spirit like power of medicine can be discovered by clinical experience, drug proving. Both cannot be discovered. Drug proving. Good, bro. Okay, bro. A weaker dynamic affection is permanently extinguished by this, the similar one, a stronger one. A weaker dynamic affection is permanently extinguished by very similar, by one very similar. Aphorism 9. Aphorism 9. So, aphorism 9, in a healthy condition of man, the spiritual vital force, the dynamics that animates the material body, rules with unbounded sway, and retain all of the parts of the organism in admirable, harmonious, vital operation, regard both sensation and function, so that our endeavoring reason gifted mind can freely employ this living, healthy instruments of higher purpose of our existence. Weaker dynamic affection is permanently extinguished by similar one. Okay. Modus operandi refers in the organism of 29 aphorism. Modus, few more months. Yeah, enjoy. Few more months of your fourth year. Otherwise, once you go in a internship, just work and go. Modus operandi. Modus operandi. 29 aphorism is modus operandi. Artificial morphic agent act at all time, all circumstances, all living human being. Okay. Inimical force are partially physical, partially psychical, partially natural. Both. Partially physical, partially psychical. Both. Partially physical and partially psychical. Okay. If two dissimilar disease meet together of equal strength, if two dissimilar disease will meet together of equal strength, or older one is stronger, then new disease will be repelled, old disease will be repelled, old disease will be suspended, new disease will be suspended, new disease will be repelled, thrown out. Okay. In dissimilar diseases, stronger is equals to weaker one, suspended but never cure. Okay. Complex disease, complex disease is in aphorism 40. Okay, complex disease is in aphorism 40. Okay, all the best, bhai. Thank you, Namit. All the best for your fourth year exam. Thank you so much. Complex disease as in aphorism 40. Nature permits simultaneous occurrence of natural disease in same body. Nature permits simultaneous occurrence of two natural disease in same body. Two indeed of three. Okay. Effects of meeting two similar disease. Effects of meeting two similar disease are double complex disease, double simplex disease, masked venereal disease, annihilate one another. Similar disease 54 D, annihilate one another. Disease which are invariable same arise from fixed miasm. Okay. Diseases which are invariable same arise from fixed miasm. In which system medicine has no pathological relation to the disease to be cured? Antipathy, isopathy, allopathy, or all? Allopathy. In which allopathy? In which system medicine has no pathological relation to the disease? Okay, allopathy. Which is the fate of antipathic treatment? Short amelioration followed by aggravation. Only amelioration, complex disease. Obviously, short amelioration followed by aggravation. Primary action is the action of medicine plus vital force. Medicine plus vital force. Medicine primary action 58. Let me confirm 58. Primary action 58. 58. So the 58 aphorism, what it says, if in sorry, what is the question? Is the question secondary action is the action of vital force 60. Obviously, during primary action the vital force, primary action is the action of, one second, it will be around here somewhere. Yeah, primary action is in 63 aphorism, sorry, 63 aphorism. Every agent that acts upon the vitality, every medicine that deranges the vital force, every agent that acts upon the vitality, uh, 63 aphorism, primary and secondary action. So for every agent that acts upon the vitality, every medicine deranges more or less the vital force and cause a certain alteration in the health of the individual for a longer or shorter period. This is termed primary action. So the primary action, what is primary action is the action of medicine plus vital force. 58 C. Every agent that acts upon the vital force to act, every medicine that deranges more or less the vital force. Okay, medicine plus vital force, right, true. Every agent that acts upon the vitality, every medicine that deranges more or less the vital force and cause certain alteration in the health of the individual for a longer or shorter period, this is termed primary action. Okay. uh, so during primary action the vital force remains passive. Yeah, during primary action the vital force remains passive, receptive. Secondary action is the action of vital force, true, which is not the characteristic of acute disease. Rapid morphid process, tendency to finish its course quickly, abnormal derangement of vital force, normal derangement, imperceptible beginning, which is not the characteristic. Imperceptible, we know beginning. Okay. The question is like, which is not the characteristics of acute disease. rapid morbid process, tendency to finish its course quickly, imperceptible beginning or abnormal derangement of vital force, imperceptible beginning. Acute disease can attack human being individually, epidemically, sporadically, always. Okay, sporadic disease can cause by transient explosions of latent sora, no. Meteoritic or telluric cause, infectious, contagious principle, calamities of war, induration, famine. Meteoric or telluric cause, okay, that is sporadic disease. So, sporadic. Okay, we'll see. Which one is the most? Which one is the most curable? Mixed massive most incurable. Which one is the most incurable? Mixed miasmatic disease, complex disease, marked venereal disease, or artificial chronic disease. Artificial chronic disease most incurable. Francis Bacon. Yes, Namit, you are right. Novum Organum was written by whom? Francis Bacon. Which one is most incurable? Artificial chronic disease. Yes, artificial chronic disease should be remedied by homeopathic medicine, palliative medicine, vital force itself, modern medicine. 65 is vital force. In case of chronic disease, symptoms should be taken before the use of medicine. In case of chronic disease, symptoms should be taken before the use of medicine, several days after continuation of medicine, or both during the use of medicine. Before the use of medicine, obviously symptoms should be taken several days after discontinuation of medicine, both. Okay. Symptoms of conjoint malady formed by the medicinal and original disease may taken in case of acute disease. Conjoint malady that is formed by medicinal and original disease. Conjoint malady is medicinal plus original disease. Which one is the true regarding lesser accessory symptoms of the chronic disease? Most characteristics difficult to obtain, very useful in choice of remedy, all. Which one is true regarding lesser accessory symptoms of chronic disease? Most characteristics difficult to obtain, very useful in choice of remedy. Okay. Which one true regarding hypochondriac patient? Great sensitiveness and impatient of suffering, describe ailment exaggerated form, portray symptoms in vivid color. All the above. To obtain to obtain complete picture of chronic disease, physicians should have tact, special circumspection, knowledge of human nature. All. In the investigation of acute disease, the physician does not require to know everything, less to inquire into, require only in, does not require to know anything, know everything. It is require in the investigation of acute disease, the physician require only to know striking symptom, less to inquire into. नहीं सब कुछ करना है. Epidemics from contagious principle is always differ from the epidemics, always remains. Epidemics from contagious principle is always differ from other epidemics, always remains same, sometimes remains same, similar in nature, always remains same. In case of epidemics totality of symptoms can be obtained by the examination of. In case of epidemics totality can be obtained. In case of epidemics totality of symptoms can be obtained by the examination of single patient. Irritable sensitive patient totality cannot be found, several patient. Okay, several patient. Which one is the following? Which one is the most difficult part in the task of physician? Selection of suitable homeopathic remedy? No. Proving of drugs? No. Studying homeopathy? No. Forming totality of the symptom? That is the best answer. Forming totality of the symptom is the most difficult part for the physician. Drug proving refers from aphorism 105 to 145. Okay, let me check. 105 to 145. Yeah. Drug proving 105 to 145. What is the true regarding drug proving? Administer several medicine, healthy prover, moderate dose, all the above. Uh, Peculiar power of medicine is known by smell, taste, appearance of drug, no. Chemical analysis, no. Curing the sick, no. Experiment on human being, yes, true. Khushi Suvarna, yes. Lord Francis Bacon's new organ, yeah, true. In a drug proving, secondary action should be recorded for drugs. Which drugs? The question is, in a drug proving secondary action should be recorded for drugs, exotic drugs, drug having alternative action, weak substance drugs, or narcotic drugs. The answer is narcotic drugs. The next question is, alternating state of various paroxysm of primary action is known as. Alternating action of various paroxysm of primary action is known as secondary curative action, secondary counteractions, alternating action, intermittent action. The answer is alternating action. Which one is true regarding idiosyncrasies? Otherwise healthy, dispositions to be brought morbid state by certain things, born with idiosyncrasies, die with idiosyncrasies. This is the all the above, idiosyncrasy. Otherwise healthy, disposition to brought morbid state by certain things, born with idiosyncrasy and die with idiosyncrasy. Anna, are you preparing for NEET? Yes, I am preparing for NEET. True. Yes, I am preparing. Yeah, Khushi, I am preparing for the NEET. An infusion should be made by cutting herbs into small pieces and pouring boiling water in case of. An infusion should be made by cutting herbs into small pieces and pouring boiling water in case of weak drug substance, exotic drugs, salt and gums, indigenous plant. No, the answer is weak drug substance. Which one cannot be taken during drug proving? Which one cannot be taken during drug proving? Boiled potatoes, young green peas, carrots, or roots and salads. 82 is C. 82 is C. 82 is C. Let me check. Diet. 82 to 104. 83 to 105 to 145. Okay, we'll read this. During drug proving, medicine should be taken 38 potency in empty stomach, 4 to 6 small globules. All the above is right answer. It is invisible to commence drug proving to strong heroic substance with small dose of drug. It is it is advisable to commence drug proving of strong heroic substance with small dose. Okay. What is the advantage of commencing drug proving with sufficiently strong dose? Learning order of succession of symptoms. Symptoms come distinctly. Symptoms come in general manner. No, the answer is learning order of succession of symptom. Okay. Commencing drug proving with sufficiently strong dose. Learning order of succession of symptom. Okay. Who is the best prover? Person who is lover of truth, delicate, sensitive person, idiosyncratic person, healthy, unprejudiced physician. He is the best prover, obviously. Yeah. Healthy, unprejudiced observer is the best prover. True material medica contains conjectural morbid state, natural morbid state, or artificial morbid state. True MM contains artificial morbid state. Suitable homeopathic remedy can subside disease of a recent date within few hours. Suitable homeopathic remedy can subside disease of a recent date within few hours, few days, few months, proportionally longer time, few hours. Indisposition can be removed by suitable homeopathic remedy, alteration of diet and regimen, antisoric remedy, or all. Alteration of indisposition. Okay, indisposition. Alteration of diet and regimen. Okay. Why? When is it? Why? Date, I think it will be in near Feb, March, April, May, June, July, and yeah, I think it will be in June, July. And why I am preparing, because I thought if I get the government college, then only I will do. Obviously, then only I will do the PG. If not, then I will start my clinic. I did not open till now. I did not open my clinic. I'm just treating the patient from my home only. So, but yeah, if I did not get government seat anywhere in the India, then I will start my clinic. That's it. Indisposition can be removed by alteration of diet and regimen. That is clear. In the selection of suitable homeopathic remedy, the symptoms should be singular, striking, uncommon, and peculiar. All above. Singular, striking, uncommon. Okay. Slight aggravation after taking minute dose of homeopathic selected remedy is known as homeopathic aggravation. That is, everyone knows. Homeopathy aggravation is slight aggravation after taking minute dose of homeopathically selected remedy. Okay. Smaller the dose of homeopathic remedy is the homeopathic aggravation, slight and shorter. Smaller the dose of homeopathic remedy, slight and shorter is the homeopathic aggravation. Homeopathic aggravation is actually due to primary action of the medicine. Primary action of the medicine. Homeopathic aggravation is actually homeopathic aggravation is actually due to primary action of medicine. Okay. Okay. Yeah. One-sided disease chiefly belongs to psoric, acute or chronic. One-sided disease chiefly belongs to chronic disease. One-sided disease is chiefly belongs to chronic disease. I am Namit's classmate. Yeah, Khushi. I think yeah. I think I have seen you. You were the in a first year or second you were the class rep. I think. Am I right? If I am not wrong, then you were a first in a first year or second year. You were a class rep. Khushi. If my memory is not so weak, then you must be a yes. You were in a first year. I think you were in a first year or second year. Your class rep. Yes, yes, yes. Yeah. See, yeah, I have a strong memory, I think. Yeah. First and second year both, I think. Yeah. I got. Uh, disease, disease which display one or two principal external symptoms are known as local disease. Disease which display one or two principal external symptoms are known as local disease. Most frequently, most frequently the chosen homeopathic remedy for one-sided disease are partially suitable. Most frequently the chosen homeopathic remedy of one-sided disease are partially suitable. Most frequently, okay, most frequently the chosen homeopathic remedy for one-sided disease are partially suitable. Local disease refers to aphorism 185 to 205. Local disease refers to aphorism 185 to 205. Local maladies 185 to 205. Yep, okay. Source of local disease that arise without external injuries are internal malady, external malady both. Source of local disease that arise without external injuries are internal malady. Most considerable and striking symptoms of local disease is most considerable and striking symptom of local disease is general morbid state of body, mind and disposition, local affection, BA plus C, local affection. Okay. Treatment of local disease should be treated with treatment of local disease should be treated with antisoric, internal with specific external, only external, internal from general store of proved medicine. Okay. Disappearance of local affection under internal homeopathic treatment indicates disappearance of local affection, disappearance of local affection, disappearance of local affection under internal homeopathic treatment indicates suppression of disease. Disappearance of local affection under internal homeopathic treatment indicates suppression of disease, palliation of disease, eradication of disease, disease still remains. Disappearance of local affection under internal homeopathic is eradication of the disease. That is the right answer. Okay. Development of local malady on some external part. Development of local malady on some external part indicates development of local malady on some external parts. Malady on development of local malady on some external parts indicate silence and internal disease. Case of internal disease, decrease of internal disease, and nothing indicates. 102 is silence of internal disease, development of local malady on some external part. Okay. Mental disease refers from 210 to 230. Mental disease refers aphorism 210 to 230. Yeah, that is 210 to 230. Mental disease 210 to 230. Mental disease 210 to 230. Okay, true. Uh, which one is the true regarding mental disease? Psoric origin, absolutely right. One-sided disease, absolutely right. Disposition in mind always altered. All the above is right answer. Mental disease contains only mental symptoms, only corporeal symptoms, equally mental and corporeal symptoms. Increases mental symptom, decreases corporeal symptom. Uh, 105 is D. Increases mental symptom, disease corporeal symptoms. 210 to 230. 1 second. Yeah. Mental disease on a psoric origin are almost all those diseases that I have termed one-sided which appears to be more difficult to cure in consequence of this one-sidedness. All their other morbid symptoms disappearing as it were, as it were, before the single great prominent symptom of this character are what are termed mental disease. They do not, however, constitute a class of disease sharply separated from all others, since in all other so-called corporeal disease the condition of the disposition and mind is always altered. Okay, and in all the cases of disease we called on to cure the state of patient disposition is to be partially noted disposition along with the totality of the symptom. If we would trace an accurate picture of the disease, it in order to be able therefore to treat the homeopathically will with success. Okay, uh, footnote 121. Often, how often for instance do we do we not meet with the mild soft disposition in patients who have for years been afflicted with the most painful disease, so that the physician feel constrained to esteem and compassionate the suffered. But if he subdue the disease and restore the patient to health, as is frequently done the homeopathic practice, he is often astonished and horrified at the frightful alteration in his disposition. The, the he often witnessed the occurrence of ingratitude, cruelty, redefined malice. Okay. Mental disease contain increased mental symptom, disease corporeal symptom. In lucid interval, symptoms become prominent. In lucid interval, corporeal symptoms become more prominent. In lucid intervals, corporeal symptoms become more prominent. Mental, both corporeal. In lucid interval, the corporeal symptoms become more prominent. Okay. Sudden occurrence of insanity, mania, etc. should be immediately treated with psychical remedy, antisoric, no antisoric, but other class of proved medicine. Sudden occurrence of insanity, mania, etc. should be immediately treated with other psychical remedy, antisoric, no antisoric, but other class of proved medicine. Okay. Treatment of mental disease that arise from emotional cause should be started with treatment of mental disease that arise from emotion should be started with psychical remedies, antisoric, no antisoric, but other than proved medicine, diet and regimen, psychical remedy. Okay. Which is true regarding alternating disease. Generally, a manifestation of developed sora, alternate at uncertain interval, alternate with morbid state of different kind, all. Okay. Generally, okay. Which is true regarding alternating disease, that we know. Which one is not the characteristic of typical intermittent disease. Morbid state return to a tolerable fixed period. Morbid state return when patient is apparently in good health, seen only in feeble morbid state. Departure of morbid state equally fixed period. Okay. Which is true regarding non-febrile typical intermittent disease. Which is true. Appear in single patient, non-febrile typical intermittent disease. Appear in single patient, appear sporadically, appear epidemically, not always belongs to chronic disease. Okay. Cinchona bark as an intermediate remedy in is necessary in cinchona bark as an intermediate remedy is necessary in alternating disease, non-febrile typical intermittent disease, epidemic intermittent fever or sporadic. Cinchona bark is as an intermediate remedy in necessary in cinchona bark as an intermediate remedy is necessary in non-febrile typical intermittent disease. Okay. Chief guide to select appropriate homeopathic remedy in epidemic intermittent fever is heat, cold, and sweating stage? No. Most prominent stage? No. Both. Intervals when patient is free from fever? Yeah, that is a right answer. Chief guide to select appropriate homeopathic remedy in epidemic fever is intervals when the patient is free from fever. Yeah. Which is the most efficacious time to administer medicine in intermittent fever? When perspiration starts just before the paroxysm, immediately after paroxysm, in between two paroxysm, immediately after paroxysm. Okay. Epidemic intermittent fevers are generally treated with antisoric, cinchona, sulfur or heparsulf, other class of proved medicine, not antisoric. In epidemic intermittent fever, which one is soric in nature? A cast, a case that cured by homeopathic specific. If first paroxysm left uncured, a case treated by allopathic drugs, all. Okay. बहुत हो गया भाई. Around 115 question I solved. Now repertory introduction. Repertory I will read later. Now I will read organ of medicine for some time, starting from aphorism 1. One second. Sorry. Yep. So we'll start reading from aphorism 1. Aphorism 1 and introduction things I will read later. First aphorism 1 I will start. Aphorism 1 to at least till 50. Let's see. Aphorism 50 till 50 I will read today. Properly I will read. So the first aphorism is, the physician high and only mission is to restore the sick to health, to cure as it is termed. The physician high and only mission is to restore the sick to health, to cure as it is termed. The highest ideal of cure is rapid, gentle and permanent restoration of the health or removal and annihilation of the disease in its whole extent. In the the highest ideal of cure is rapid, gentle and permanent restoration of the health or removal and annihilation of the disease in its whole extent, in the shortest, most reliable and most harmless way, on easily comprehensive principle. Third, if the physician clearly perceive what is to be cured in the disease, that is to say, if the physician clearly perceive what is to be cured in disease, that is to say, in every individual case of the disease, knowledge of disease indication, if he clearly perceive what is curative in medicine, that is to say, in each individual medicine, knowledge of medicinal power, and if he knows how to adapt according to clearly defined principle what is curative in medicine to what he has discovered to be undoubtedly morbid in the patient, so that the recovery must ensue, to adapt it as well as in respect to the suitability of the medicine most appropriate according to its mode of action to the case before him, choice of remedy, the medicine indicated, as also in respect to the exact mode of preparation and quantity of a required proper dose and the proper period of repeating the dose. If finally he knows the obstacles to recovery in each case and is aware how to remove them so that the restoration may be permanent, then he understands how to treat judicially and rationally, and he is a true practitioner of healing art. The fourth aphorism is, he is likewise a preserver of a health if he knows the thing that deranges the health. He is likewise a preserver of health if he knows the thing that deranges the health and cause disease and how to remove them from person to health. Okay. He is likewise a preserver of health if he knows the thing that deranges health and cause disease and how to remove them from person in health. Okay. Aphorism number 5. use Useful to a physician in assisting him to cure useful to the physician in assisting him to cure are the particular of the most probable exciting cause of the exciting cause of the acute disease. Sorry. Useful to the physician in assisting him to cure are the particular of most probable exciting cause of the acute disease, as also the most significant point in the whole history of the chronic disease to enable him to discover fundamental cause, exciting cause, fundamental cause, which is generally exciting cause in acute disease, fundamental cause in chronic disease, which is generally due to chronic miasm. Okay, fundamental cause is due to chronic miasm. In these investigations, the ascertainable physical constitution of the patient, uh, the physical constitution of the patient, especially when the disease is chronic, his moral and intellectual character, his moral and intellectual character, his occupation, mode of living and habits, his social and domestic relation, his age, sexual function, etc., are to be kept into consideration. That is the fifth aphorism: exciting cause and fundamental cause. Okay. Aphorism number 6: the unprejudiced observer. The unprejudiced observer, well aware of the futility of the transcendental speculation which can be perceived no confirmation from experience. An unprejudiced observer, well aware of the futility of transcendental speculation which can receive no confirmation from experience, be his power of penetration ever so great, takes note of nothing in every individual disease except the change of health of the body and the mind, morbid phenomena, accident, symptoms, which can be perceived externally by means of the sense. That is to say, he notices only the deviation from the former healthy state of the now diseased individual, which are felt by the patient himself, remarked by those around him, which are felt by the patient himself, remarked by those around him, and observed by the physician. All these perceptible signs represent the disease in its whole extent. That is, together they form the true and only conceivable portrait of the disease. Okay. Therefore, uh, footnote 2. I know not, therefore, how it is possible for physician at the sick bed to allow themselves to suppose that without most careful attending of the symptoms and being guided by them in the treatment, they ought to seek and could discover only in the hidden and unknown interior what there was to be cured in the disease, arrogantly and ludicrously pretending that they could, without paying much attention to the symptom, discover that alteration that had occurred in the invisible interior and set it to right with unknown medicine, and that such a procedure at his at this could be alone called radical and rational treatment. Okay. Now, as in the disease from which no manifest exciting, seventh aphorism, prima causa, okay, exciting maintenance, causa occasionalis. Okay. Now, as in the disease from which no manifest exciting or maintaining cause, here it was fundamental cause. Okay, exciting cause and fundamental. Now, as in the disease from which no manifesting exciting or maintaining cause, causa occasionalis, has to be removed. Okay, we can perceive nothing but the morbid symptoms. It must regard being had to the possibility of the miasm and attention paid to be accessory circumstances, to be the symptoms alone by which the disease demands and points to the remedy suited to relieve it, and moreover the totality of these its symptoms of this outwardly okay, symptom symptoms, and moreover the totality of these its symptoms are This outwardly reflected picture of the internal essence of the disease, that is of affection of the vital force. The symptom is nothing but the outwardly reflected picture of the internal essence of the disease, that is of affection of the vital force, must be principle or the sole means whereby the disease can make known what remedy is required, the only thing that can determine the choice of the most appropriate remedy, and thus in a word the totality of the symptom must be principle, indeed the only thing the physician has to take note in every case of disease and to remove by means of his art, in order to in order that the disease shall be cured and transformed into health. The totality we have to remove. Eighth aphorism: it is not conceivable nor can it be proved by any experience in the world that after removal of all the symptom of the disease and of the entire collection of the perceptible phenomena, it is not conceivable nor can be proved by any experience in the world that after removal of all the symptoms of the disease and of the entire collection of the perceptible phenomena, there should or could remain anything else besides health, or that the morbid alteration in the interior could remain uneradicated. Okay, means it is in aphorism 8, what is the mention: it is not conceivable nor can be proved by any experience in the world that after removal of all the symptoms of the disease and the entire collection of the perceptible phenomenon, there should be could or remain anything beside. सिम्टम्स निकालने के बाद अगर कुछ भी नहीं बचता है, तो इसका मतलब यही है कि patient cure हो चुका, or that the morbid alteration of the interior could remain uneradicated. When a patient has to be cured, when the patient has been cured by his disease by a true physician in such a manner that no trace of the disease, no morbid symptom remains, and all the signs of the health have permanently returned. How can anyone, without of offering an insult to common sense, affirm in such an individual the whole bodily disease still remains in the interior? And yet the chief of the old school Hoofland, okay, eighth aphorism, Hoofland, okay, Hoofland assert this in the following words: homeopathy can remove the symptom, but the disease remains. It is mentioned in the aphorism number 8, footnote 5. This this he maintains partially from mortification of the progress made by homeopathy to the benefits of the mankind, partially because he still holds thoroughly material notions respecting disease, which he is still unable to regard as state of being the organism where it is dynamically altered by the morbidly deranged vital force as an altered state of health, but he views the disease as a something material, which after the cure is completed may still remain lurking in some corner in the interior of the body, in order some day during the most vigorous health to burst forth at its pleasure with its material presence. So dreadful is still the blindness of old pathology. No wonder that it could only produce a system of therapeutic which is solely occupied with soaring out of poor patient. Okay. Hoofland General, homeopathy can remove the symptom but the disease remain. Who quoted this? Hoofland. Homeopathy can remove the symptom but disease remain. Okay. Aphorism number 9, vital force. In a healthy condition of man, the spiritual vital force autocracy, the dynamics that animates the material body organism, rules with unbounded sway and retain all the parts of the organism in admirable, harmonious, vital operation as regard both sensation and function, so that our indwelling reason gifted mind can freely employ this living or the living healthy instrument for the higher purpose of our existence. This is the aphorism number 9 about vital force. Aphorism number 10, the material organism without the vital force is capable of no sensation, no function, no self preservation. The material organism without the vital force is capable of no sensation, no function, no self preservance. It deserves all sensation and perform all it derives all sensation and perform all the function of life solely by means of immaterial being vital principle which animates the material organism in health and in disease. Aphorism number 9. Aphorism number, okay, uh, 6, where it is written the 6. 5, 6. The material organism without the vital force is unable to is, the material organism without the vital forces is capable of no sensation, no function, no self preservation. uh, Footnote number 6, what is that? It is dead and now only subject to the power of external physical world. It decays and it is again resolved into a chemical constituent. Without the vital force, the body is like a, it is a dead and now only subject to the power of external physical world. It decays and is again resolved into a chemical constituents. Okay. Aphorism number 11. When a person fall ill, it is only his spiritual, self-acting, automatic vital force everywhere present in the organism that is primarily deranged by the dynamic influence upon it of a morbific agent inimical to life. It is only the vital principle deranged to such an abnormal state that can furnish the organism with its disagreeable sensation and incline to the irregular process which we call disease. For such a power, for as a power invisible in itself and only cognizable by its effects of organism, its morbid derangement only makes itself known by the manifestation of disease in the sensation and function of those parts of the organism exposed to sense of the observer and physician, that is, by morbid symptoms, and in no other way can it make itself known. Okay. So materia peccans. What is dynamic influence? Dynamic power. Our earth by virtue of hidden invisible energies. These are things are mentioned in the aphorism number 12. I am going to read the aphorism number 12. It is morbidly affected vital energy, internal spiritual dynamics. Okay, let's see. It is morbidly affected vital energy alone that produces disease. Okay, morbidly affected vital energy that produces disease. So that morbid phenomena perceptible to our senses express at the same time all the internal changes. That is to say, the whole morbid derangement of the internal dynamics. In a word, they reveal the whole disease. Okay. Also, the disappearance under treatment of the all morbid phenomena and all of morbid alteration that differ from healthy vital operation certainly affects necessarily implies the restoration of integrity of the vital force and therefore the recovered health of the whole organism. Obviously, it is written properly. How how the vital force causes the organism to display morbid phenomenon, that is how it produces disease. It would be of no practical utility of the physicians to know and will forever remain concealed for him. Only what is necessary for him to know the disease and what is fully sufficient for enabling him to cure has Lord of life revealed to his senses. Okay. Aphorism number 13. Therefore, disease that does not come within the province of manual surgery, considered as it is by the whole allopathist. Therefore, disease that does not come within the province of manual surgery, therefore disease considered as it is by the allopaths as the thing separate from the living whole from the organism and its animating vital force and hidden in the interior, be it of ever so subtle a substance, is an absurdity that could only be imagined by minds of a materialistic stamp and has for thousands of years given to prevailing system of medicine all those pernicious impulses that have made it to truly mischievous, non-healing art. Okay. 14th aphorism. The 14th aphorism says, there is in the interior of man nothing morbid than that is curable, and no visible morbid alteration that is curable. Wait, there is in the interior of man nothing morbid that is curable, nothing morbid that is curable, and no visible morbid alteration that is curable, which does not make itself known to accurately observing physician by means of morbid signs and symptoms. An arrangement of perfect conformity with the infinite goodness of all wise preserver of human life. Okay. The affection of the the affection of the morbidly deranged spirit like dynamism. Now the aphorism is 17. Most severe footnote 9. Most severe disease may be produced by sufficient disturbance of vital force through the imagination and also cured by the same means. 17. Now, as in the cure affected by removal of the whole of the perceptible signs and symptoms of the disease, the internal alteration of the vital principle to which the disease is due, consequently the whole of the disease as it at the same time removed. Now, as in the cure affected by the removal of the whole of the perceptible. Now, as in the cure affected by removal of the whole perceptible sign and symptom of the disease, the internal alteration of the vital force to which the disease is due, consequently the whole of the disease is at the same time removed. The warning dream a superstitious fancy. Okay. It follows the physician and only to remove the whole of the symptom in order at the same time to abrogate, annihilate the internal change, that is to say, the morbid derangement of vital force, consequently the totality of the disease itself. But when the disease is annihilated, health is restored, and this is the highest, the sole aim of the physician who knows the true object of his mission, which consists not in learned sounding prating but in giving aid to the sick. Okay. Now, the aphorism number 18. For this un, in, indefinable, undefinable, 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 indubitable truth that beside the totality of the symptom which consideration of the accompanying modality nothing can by any means be discovered in disease. By this indubitable truth that beside the totality of the symptom with consideration of the accompanying modality nothing can by any means of discovered in disease wherewith they could express their need of aid. It follows undeniably that the sum of all the symptoms and condition in each individual case of disease must be the sole indication, the sole guide to direct us in the choice of the remedy. Okay. Curative power of medicine. Now, as disease are nothing more than alteration in the state of the health. Now as disease are nothing more than alteration in the state of health of the healthy individual which expresses themselves by morbid sign and the cure is only by possible by change to the healthy condition to a state of health of a diseased individual. It is it is very evident that medicine could never cure disease if they did not possess the power of altering man's state. Okay, a health which depends on sensation and function, indeed that their curative power must be owing solely to this power they possess of altering man's state of health. Okay. Aphorism number 20th. This spirit like power to alter man's state of health which lies hidden in the inner part of the medicine. The spirit like power of to alter man's state of health which lies hidden in the inner nature of the medicine can in itself never be discovered by us by mere effort of the reason. It is only by experience of the phenomenon in displays when acting on the state of health by man that we can become clearly cognate. Now we'll read the uh, 22 aphorism. From 22 to 25, I think it is mentioned different therapeutic method. So we'll read. But as nothing to be observed in disease that must be removed in order to change them into health beside the totality of their sign and symptoms. And likewise, medicine can show nothing curative beside their tendency to produce morbid symptoms in healthy person to and to remove them in a diseased person. It follows on the other hand that medicine only become remedies and capable of annihilating disease. True, because the medicinal substance by exciting certain effects and symptoms, that is to say by producing a certain artificial morbid state, remove and abrogate the symptoms already present, to wit, the natural morbid state we wish to cure. On the other hand, it follows that for a totality of the symptoms of the disease to be cured, that medicine must be sought which, according as experience shall prove whether the morbid symptom are most radially, certainly, and permanently removed and changed into health by similar or opposite medicinal symptom. Uh, Footnote number 12 will see the, the other possible mode of employing medicine for the disease beside these two is the allopathic method in which medicine are given though whose symptoms has no direct pathological okay, it is mentioned in the 12th footnote. What is mentioned? Allopathic method in which medicines are given though whose symptoms have no direct pathological relation to the morbid state, neither similar nor opposite, but quite heterogeneous to the symptoms of the disease. This procedure plays, as I have shown elsewhere, an irresponsible murderer's game with the life of the patient by means of dangerous, violent medicine, whose action is unknown and which are chosen on mere conjecture and given in a large and frequent doses, again by means of painful operation, indeed to lead the disease to other region and taking the strength of vital juices of the patient through evacuation above the below sweat and salivation, but especially through squandering the irrepressible blood as is done by reaching routine practice used blindly and relentlessly, usually with the pretext and the physician should imitate and further the sick nature of its effort to help. Okay, these are things are mentioned. All pure experience, however, all accurate research convince us that persistent symptom of the disease, as far from being removed and annihilated by opposite symptom of the medicine, as in the antipathic, enantiopathic or palliative method. That is, on the contrary, after transient apparent elevation, they break forth again only. Right. As pure experience, all pure experience, however, all accurate research convinces us that persistent symptoms of the disease are for being removed and annihilated by opposite symptoms of the disease, as in antipathy, in angiopathy and palliative manner. That is, on the contrary, after transient apparent elevation, they break forth again only with increased intensity and become manifestly aggravated. There remains therefore no other mode of employing medicine in disease that promises to be service besides the homeopathy, by means of which we seek for the totality of the symptom of the case of the disease, a medicine which among all medicine whose pathogenetic effects are known from having been tested in healthy individual, has the power of tendency to produce the artificial morbid state most similar to the case of the disease in question. Yeah. Now, however, in all careful trials, pure experience, however, in all careful trials, pure experience. What is pure experience? I do not mean that sort of experience of which the ordinary practitioner of the old school boast, after they have for year worked away with a lot of complex prescription on a number of disease which they never carefully investigated, but which, faithful to the tenets of their school, they considered as already described in works of systemic pathology, and dreamed that they could detect in them some imaginary morphic matter as ascribed to them some other hypothetical internal abnormality. They always saw something in them, but knew not what it was they saw, and they got result from the small complex forces acting on an unknown object that no human being but only a god could have unraveled, results from which nothing can be learned, no experience gained. 50 years experience of this sort, in this 50 years of looking into, filled with the known colored object and perpetuality turning round, thought to be over changing figure and no accounting of them. Okay, what is the 25th aphorism? Now, however, in all careful trials, pure experience, the sole and infallible oracle of the healing art, that teaches us that actually that medicine which in its action on the healthy human body has demonstrated its power to producing the greatest number of symptoms similar to those observable in the case of disease under treatment. Okay, does also in doses of suitable potency and attenuation rapidly, radically and permanently remove the totality of the symptom and this morbid state, that is to say 6 to 16, the whole disease present, and change it into health, and that all medicines cure without exception and disease whose symptom most nearly resembles their own and leave none of them uncured. Okay, nature's law of cure is 26th aphorism. The The weaker dynamic affection is permanently extinguished in a living organism. The weaker dynamic affection is permanently extinguished in liver organism by a stronger one. If the latter, if the latter is very similar to the former in its manifestation. A weaker dynamic affection is permanently extinguished. Nature's law of cure is the weaker dynamic affection is permanently extinguished in a living organism by a stronger one, if the latter is very similar to the former in its manifestation. Thus, uh, footnote number 14, thus are cured both physical affection and moral maladies. How is it that in a early dawn the brilliant Jupiter vanishes from a gaze? Okay, distinguished. Okay. The curative power of the medicine therefore depends on their symptoms similar to the disease but superior to it in strength. The curative power of the medicine therefore depends on their symptoms similar to the disease but superior to in strength, so that each individual case of disease is surely, radically, rapidly, and permanently annihilated and removed only by a medicine capable of producing in the human system in the most similar and complete manner the totality of the symptom which at the same time are stronger than the disease. Okay, let's take a break. It's 1.5 hours, I think. So yeah, 27th aphorism. The curative power of medicine therefore depends upon their symptoms. Curative power of the medicine therefore depend upon their symptoms similar to the disease but superior to its strength, that everyone knows. So that each individual case of the disease is almost surely, radically, rapidly, and permanently annihilated and removed only by a medicine capable of producing in the human system in the most similar and complete manner the totality of the symptom which at the same time is stronger than the disease. Yeah, that is true. At the same 28th aphorism. Sorry. At this natural law of cure manifests itself a very pure experiment, and every true observation in the world that the fact is consequently established. It matters little what may be the scientific explanation of how it takes place, and I do not attach much importance to the attempt made to explain it. But the following view seems to commend itself as the most probable one, as it is founded on premises derived from experience. Okay, modus operandi, 29th. At every disease, not entirely surgical, consists only a special morbid dynamic alteration of our vital energy, of a principle of life manifested in certain and motion. So, in every homeopathic cure, this principle of life, dynamically altered by natural disease, is seized through the administration of the medicinal potency, selected exactly according to the symptom similarity by a somewhat stronger similar artificial disease manifestation. By this, the feeling of the natural weaker dynamic disease manifestation ceases and disappears. This disease manifestation no longer exists for the principle of life, which is now occupied and governed merely by the stronger artificial disease manifestation. This artificial disease manifestation has sooner spent in force and leaves the patients free from disease, cured. The dynamism thus freed can now continue to carry life on in health. This this most highly probable process rests upon the following proposition. Okay. Aphorism number 30. The human body appears to admit of being much more powerfully affected in its health by medicine, partially because we have regulation of dose in our own power, than by natural morbid stimuli, for natural disease are cured and overcome by suitable medicine. The short duration of the action of the artificial morphic force, which we term medicine, make it possible that, although they are stronger than the natural disease, they can yet be much more easily overcome by vital force than can be weaker natural disease, which solely in consequence of the longer, generally lifelong duration of their action. Soras, syphilis, psychosis can never be vanished and extinguished by it alone until the physician affects the vital force in a stronger manner by an agent that produces the disease very similar but stronger, to wit a homeopathic medicine. The cure of disease of many years duration by the occurrence of smallpox and measles, both of which run in a course of a few weeks and process of a similar derangement character. Okay. Now the aphorism 31 I am going to read. 31. The inimical force, partially psychical, partially physical, to which our terrestrial existence is exposed, which are termed morphic noxious agent. What is morphic noxious agent is? MOR, morphic noxious agent is nothing but partially inimical force is partially physical and partially psychical, do not possess the power of morbidly deranging the health of man unconditionally. Okay, but we are made ill by them only when our organism is sufficiently disposed and susceptible to the attack of morbific cause that may be present and to go be altered in its health, deranged and made to undergo abnormal sensation and function. Hence, they do not produce disease in everyone nor at all times. Okay, 2 minutes more, then I will stop my streaming. Today's 1.5 hour is enough, I think. So, so today I just completed from 1st to 30th aphorism, and tomorrow I will read from 31st to at least 60 aphorism, and I will solve some MCQs also. Till that, we'll see. Okay, bye bye. If any question is there, you can ask regarding anything about homeopathy, about how to solve MCQs, how to study materia medica, everything. Okay, bye.